Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everybody. Welcome to the next episode of Power Up Recovery with Nutrition. This is your opportunity to listen to scientific research, experts in the field, practitioners, and ordinary people with life changing stories. Today, I'm excited to welcome Andrea Nakayama, who is a leader in functional nutrition coaching and training, and this approach to all around health. Welcome, Andrea.
Thank you, Christina. I'm so thrilled to be with you.
So, what would you like to share about yourself?
Yes, as you said, I'm a functional medicine nutritionist and the founder of the Functional Nutrition Alliance, where I've trained almost 9,000 practitioners now in over 68 countries. I am also a mom to an adult son who's about to move to Tokyo. I'm widowed, which is what brought me into this field. And I am a passionate writer and practitioner of narrative medicine.
There we go. Lady after my own heart.
Yes, and it'll all weave through the conversation we're about to have.
So, what sets you and your approach apart from that of other functional medical practitioners and teachers?
Yeah, I mean, I really do think that the practice of functional medicine has kind of gotten away from its roots. And
Mm-hmm.
its roots are about three primary tenets. And those tenets are embracing a therapeutic partnership, looking for the root causes, and I'm going to underscore the S, and a systems based approach. And so, my teaching, my methodology, everything I'm doing at the Functional Nutrition Alliance and in my own writing is really honoring those three primary tenets that were at the inception of a truly functional practice. Now, functional medicine has gotten into all sorts of arenas where it's about optimization and lab testing and all these things that I think have gotten us away from those primary tenets. I'm not against those things. I just think
Mm-hmm.
they have a time and a place, and oftentimes they are leading the way. So, what I do is I teach physiological function as a way to be our clues and have a better understanding of what's going on with every client or patient that we're seeing. It's also very agnostic. I work with people who come from healthcare backgrounds and no healthcare backgrounds, lots of nurses, mental health providers, registered dietitians, physical therapists, occupational therapists, doctors, massage therapists, estheticians, health coaches, and people who come from no healthcare background but are really eager to help
Right.
others to finally feel better. And so, in that way, the teaching is agnostic. in that it can meet anybody depending on their scope of practice, help us understand scope of practice, but also be applicable whether you work with autoimmunity or menopause or mental health or addiction or
Sure.
fertility issues. And that's because it's a way of thinking about a person
Yes.
and a case versus a protocol. And a lot, going back to my initial point, a lot of functional medicine and functional nutrition has become very protocol based. And that's just not the way I teach.
Right. Nor do I teach.
I know.
Yeah.
I love
So
it.
it's what we have in common.
Yes.
So, if we were then to focus the conversation on mental health and addiction, and you are sort of physiology function based, tell us your thoughts on that.
Yeah. So when I talk about a therapeutic partnership, looking for the root causes and a systems based approach as those three primary tenets, I use several tools that help us to think into a case. And I'll come back to your questions specifically, but I think this will help us to ground. One of the tools I use is the functional nutrition matrix, which you're very familiar with because you were on my podcast when I offered it, the 15-minute matrix. And the matrix helps us to map a client case. So we're not just seeing them as their sign, symptom, or diagnosis. We're seeing them as a whole. And the three major parts or categories on the matrix are the story, the soup, and the skill. So the story is what's often missing in functional medicine and why I studied narrative medicine. It really helps us
Yeah.
understand who is this? In functional medicine, we call it the ATMs, the antecedents, the triggers, and the mediators. But what can I learn that you, as my client or patient, is the expert in? I know nothing
Right.
about your expertise in you and where you come from and what's happened through your life. That's our story. The soup is the physiological function, the systems biology, or as I call it, the full body systems, right? That
Mhm.
helps us understand that there might be multiple things going, there are likely multiple things going on. There's likely not just addiction or mental health issues. There's other things happening in your
That's
body.
right.
And I'm going to see the whole because I recognize that it's not a stew, it's not a bunch of ologies, it's a soup. It's all in there together. And the
Yeah.
skill is what do we do about it? What's the nutrition and hydration, the sleep and relaxation, the exercise and movement, stress and resilience, relationship networks? But I need to see the whole. That really outlines my approach. So when I see somebody with a sign, a symptom, or a diagnosis, that leads me to one of my second principles I work with, or second tools or strategies, which I call three roots, many branches. Anything that is expressing as a sign, a symptom, or a diagnosis, mental health challenges and addiction included, in my arena is a branch. I'm going to work with experts like you who are really, really focused on the branch. But as a functional medicine nutritionist, I'm working on not just the roots, and there are always three, which I'll talk about, but the soil that those roots live in. So my job and my scope is, and then in the scope I teach others, is to focus on the terrain, which is allowing those signs, symptoms, or diagnoses to express. And that takes me out of the branches and into a different focus that supports you and I, for
Absolutely.
instance, working together.
So, can you tell us more about the terrain and
Yeah.
what a good terrain is and what a not so good terrain may consist of?
Yes. So the three roots for me in any chronic health condition, mental health or otherwise, are the genes, digestion, and inflammation. Those are the three roots.
Yeah.
The branches, if you can
Yeah.
name a sign, symptom, or diagnosis, that is a branch. The roots are the genes, digestion, inflammation. You can picture a Venn diagram. The terrain is the soil in which each of those roots live. And I call that the circle of influence. So around our genes, we have our food, our movement, our environment, and our mindset. And I'm thinking about all those factors that influence our genes. And as you and I know,
Mhm.
that's called the epigenetics. Those are
That's right.
epigenetic factors. With digestion, I'm focused on optimizing the receptacle for the food and nutrition. So I'm thinking about the circle of influence being the mechanical, the chemical, the structural, and the microbial. And I'm not focused on one of those things. I'm constantly working on all of them. That's terrain. For
Yeah.
inflammation, it's clear, calm, enhance, and modulate. And sure, I may need to clear a food. I may need to clear sugar. I may need to clear any inflammatory food. I may need to clear an infection. I may need to clear a negative mindset. I may need to clear a story. I'm thinking of the word clear in a very broad sense,
Yeah.
but calming the nervous system is
Yeah.
what allows us to get into the body's potential for healing. And when the body's not in a calm state, when it's constantly in fight or flight for whatever reason, yeah, exactly, we cannot heal. And so looking at that as the terrain, it's the circle of influence that each of those three roots live in, that I'm working on optimizing to help a person see what shifts in the branches, in the expression.
Right. Right. And of course, that impacts digestion tremendously,
Correct. Everything.
right?
Yep.
Are we
Impacts
eating
everything.
from a calm place? Are we eating from an anxious or rushed place? Yeah,
Exactly. Exactly. Yeah. They call it rest and digest instead of fight or flight for a reason.
they do. And we tend to forget about that.
Yes. We have to remember that to heal, we need to be in a parasympathetic dominant state. Sympathetic dominant state is that fight or flight. And to my earlier point, Christina, in terms of what sets my teaching and training apart from functional medicine, I think we have put patients in a situation where they are self diagnosing, looking for one route to what's wrong with them that really perpetuates a fight or flight state. And that's
Mhm.
where my training has shifted and my thinking has shifted over time to really understand, how do we help this person not have shame around what they're experiencing, not really be doing all these things that make them feel like they've done something wrong or they're bad, for the expression of what's happening deeper within their body.
And it's so easy to do that with mental health diagnoses,
Exactly.
especially.
Yes. Yeah, I see it not just with mental health diagnoses, I see it with like weight gain and with like
Yeah.
numbers on labs that people thought they were working on and should have better. There's so much self blame that goes into the equation. The longevity movement and this idea that we should be able to optimize everything about our bodies is really leading people to seek and be on this quest, which does not allow for that parasympathetic dominant rest and digest joyful place.
Yeah, I'm just sort of thinking about that because that is very goal oriented.
Yes,
We want to achieve a particular goal. We want to put
exactly.
everything in its place and fix everything so that we can be whatever it is
Exactly.
we want to be.
Yes.
And what I hear you saying is, ooh, let's step a few steps back. Let's look at the deep down container. As you say, the terrain, the
Yes.
soil.
Yes.
And let's make sure that you're okay as a person, that the that you are supporting your genes and your genetic expression optimally. And here's a variety of ways to do that.
Exactly. We're
That,
going broad instead of narrow. A lot
yeah.
of what's out there for us in terms of feeling like we're broken goes very narrow. Here's the protocol for this particular condition. And there's a lot we can do in a broad sense.
Mm-hmm. No, that there absolutely is. And to some degree, I am guilty of that, not because of my mindset, but because of how do you actually teach application of this, right?
Yeah. Yeah.
In an absorbable way.
Yeah.
So, my core one training, which is I'm going to make you, to the best of my ability, an expert at amino acid therapy with, nutrients in food for addictive and behavioral disorders. Ooh, that's wonderful, right? And it's very symptom oriented.
Yes.
And it's very symptom oriented because we get to.
Yes, exactly.
You see, we get to use very powerful nutraceuticals.
Yes.
There we go. To come in from the top, but also from the bottom
Yes.
to support brain functioning and therefore to by supporting brain functioning, by giving the brain what it needs to function optimally, we can improve mood and behavior very, very quickly.
Yes, and so
And
important. And the two can work together is
you
what I'm
see,
trying to like I always
that's
try to
it.
tell the people that I'm training, we're not replacing the specialist. We are
No.
working in tandem with the everyday decisions that
Yes.
somebody is making when they're working with a specialist. And you can be a specialist in something else too and come.
Well, you can. But you see, that's then why I have my level two training, right? We start with, okay, here's what you can do in the moment to improve somebody's mood and behavior.
Yes.
Let's look at what they're putting in their mouth. And that's, whether it be food or supplements, and let's really understand that. And then in level two, all right, people, now let's jump in.
Yes.
Let's look at how the body is functioning as a whole. Let's look at how
Absolutely.
all the pieces interact.
Yes.
And let's start with digestion. Oops,
Yes.
because, ingestion matters. What you
Yes.
put into your mouth matters, but it doesn't stop there.
Correct.
Yeah,
Absolutely. And I think that that's so important. I always like to say there's no quick fix unless there is. And if there is a quick fix and we can
yeah,
bring that in to help somebody feel better, whether it's a nutraceutical like a magnesium or it's amino acids, like if we can help people feel better in the short term, let's do that to calm the entire system. And
that's right.
then we can go deeper. What I often see is that people have, they're not getting to that deeper place. And
That's
so
right. We
that's
stay
where
right
the
up
work
here.
goes. Yes. So it's the two together that I think are really, really looking at the named sign, symptom, or diagnosis from a more targeted lens
Mhm.
and the entire ecosystem where people are making decisions for themselves day in and day out,
Yes, we
24
are.
hours a day. And it can be really confusing with all the noise out there to understand what to do. And the truth is, and I'm sure you see this, Christina, people are not tuned in to how their body feels. I call this, interoception. We've lost our interoception. We're
Yes,
farming out what we think is going to fix us as opposed to going, you know what? I don't feel good when I eat that, do that, stay up late, whatever it is. I'm going to adjust.
right. People will ask me, well, what amino acid should I take for depression? Or my sister's anxious. What amino acid should I take? And it's like, I don't know.
Right.
I
That's right.
don't have the foggiest idea. Let's get some information.
Exactly. Exactly.
Let's look at the picture. Let's learn
Exactly.
about your sister. Let's learn about her anxiety,
Yes.
right? Let's get rid of these big name labels. Okay, big name labels can have some use.
Yes.
We like containers into which symptoms we drop symptoms, but the the label is not even the disorder. We've got so many different types of depression and so many different types of
Exactly.
anxiety and so many different types of insomnia.
Yeah. Exactly. And what you're referring to is what I call the art of the practice: assess, recommend, track,
Mhm.
repeat. And without a proper assessment, if we are giving recommendations without understanding who that person is, we've bypassed that first tenet of a truly functional practice, which is a therapeutic partnership, because we haven't made time to see the person. We've only made time to see the sign, symptom, or diagnosis that the person has.
Yeah, yeah. You know, to speak to a point you made earlier, the tension between addressing symptoms and looking for root cause, and then even going underneath root cause to,
Yeah.
the whole person terrain. I've had so many practitioners say to me, well, I don't want to use amino acids because that's not addressing the root cause. I was like, true. Well, it may be actually
Yeah.
halfway,
Yeah.
but how are you going to support this poor client of yours while you are getting to the root cause,
Yes.
while you are, identifying this, and this, and you're fixing this, and this, and you're changing this, and this? Meanwhile, they're suicidal, they're craving, they can't get out of bed,
Yes.
and they don't have the wherewithal to follow any of your recommendations, no matter how wonderful your recommendations are, because they're so profoundly depleted.
Exactly. I think that's a really good point to talk into in relation to the assessment. If there is an urgent need for intervention, that urgent need needs to be addressed. We don't get to be in the let's slow this down. There are times when we are in the slow this down and when we know somebody else is addressing the major pain point, right? Like if somebody's about to have surgery and they have cancer, I am not slowing down to say, like, how do we deal with the cancer? I am in the reality that we are dealing with going into surgery and recovering from surgery. That's the first order of priority. So,
That's right.
as clinicians
And we
sitting,
get to.
we get to figure out like where is the time and the place. If somebody comes to me and says I'm, feeling a little fatigued and I'm started gaining weight even though I'm lifting weights all the time and I don't understand what's going on, then I'm like, okay, let's slow down and back things up. So it really is understanding what is this situation presenting to me, and are we in an urgent situation? And is that urgent situation in my scope and in my hands? Or am
Right.
I ensuring that that person has the right support for that urgency?
Exactly. And this is where teamwork comes in.
Yes, 1000%.
Teamwork, referral,
Yep.
partnership, having various different experts in your back pocket.
Exactly. I mean, to use that example of surgery, I'm not doing the surgery, but I can help somebody prepare mentally, physiologically for their surgery,
Yes,
and
you
I can
can.
help them recover from their surgery. So I think
Yes.
one of the things that often gets
To
mis
make the work
yeah,
of the expert more effective.
exactly, more effective and easier. We're putting way too much pressure on our medical providers. It's
Yeah.
not about trying to be them. It's actually they're the most depressed people in the industry. There's higher rates of death by suicide among our medical providers, and we're asking way too much of them. People will say, my doctor told me there's nothing that I can do with food to support my Crohn's disease. And it's like, well, that's not in their expertise. Are you asking them what toilet paper or toothpaste to use? Like, no. Why are you asking them about your food? We have to go to experts who understand those nuances about
That's right.
food, which you and I are talking about, and not talk to the wrong people about the wrong things, right? That's where the team comes in.
I think that's a beautiful way of putting it.
It's
Yeah.
important, right?
It's crucial.
Yes.
It's
Yes.
crucial. I mean, I want to get mad at the doctors for not knowing about food, but I don't know what they know.
Oh, 17 hours of training in their tens of thousands of hours. And they're about to change that and increase it a little bit in some states, but it's still
Right.
not going to be really tailored to the individual. And let me just give a
No,
functional medicine equivalent here. So, functional medicine docs do tend to understand that nutrition and dietary and lifestyle factors make a difference. They're still not trained in it. So, the answer may be a handout, right? So, they may see, oh, you're pre diabetic, you should eat a keto diet and be intermittent fasting. What they don't know is you have a history of disordered eating, that food restriction makes you really anxious, that when you restrict certain kinds of foods, you don't know how your body doesn't know how to adapt and starts doing different things that don't feel good. That's not your doctor's expertise. That's a nutrition professionals' expertise to go, let's slow this down. Wait, why do you want to go on keto? What do you
that's
think
right.
intermittent fasting is going to do for you? Let's make sure your body is getting what it needs. Because
Yes.
when the
Thank you.
body's depleted, we're going to start to have mental health issues as well.
You know that exactly. Again, people will ask me, well, you know, my clients are intermittently fasting, or should I intermittently fast? And it's like, I don't
It
know.
depends. It depends, right?
It depends on all sorts of things.
Correct.
And one really important question you can ask your client is at the end of your fasting window, how are you feeling?
And why? Why do you
How
want
are
to
you
do that?
behaving? Well, and why? Why are you doing it exactly? What do you hope to get from it?
Yes.
But are you still a nice person at the end of your fasting window?
Yes.
Or
Or
is
are
your
you
family
reaching
saying,
for
when are you going to eat? When are you going to eat? Please eat so that you can become nice again.
exactly, exactly. Or is your is your body metabolizing foods differently than you had hoped? So, one thing I'm seeing more and more of lately is the protein craze. And Christina, you and I are old enough to have lived through many different crazes in terms of
That's right.
food that we can see impact how the body and brain function. Like we've
Mhm.
lived through them. So right now we're in the protein craze, right? We've been through it all. I am all for protein and the importance of the amino acids. But what I'm seeing with a lot of women over 50, and I'm 59, I'm seeing that they are putting on weight that they don't understand as they moved to a high protein diet. So there's a few different reasons that that could be happening, but one of them is how the body starts to convert proteins through gluconeogenesis into sugars if it's not getting the
That's
carbohydrates it needs. Of course, we don't want the wrong kind of, and I put that in quotes, wrong. We want to make sure we're feeding our bodies the carbohydrates it does need and not the ones that can be damaging to the system. But the body is complex. And all this dietary theory that we're fed on media, on social media, isn't necessarily right for your body or your body in this period of time.
or or your body needs extra support in certain areas,
Thousand
right?
percent.
As we age and our digestive enzymes drop,
Correct. And our hydrochloric
or as
acid.
we age and for whatever reason our stress increases
Yes.
and our digestive enzymes decrease,
Yes.
right?
Exactly. Exactly.
We may
Yeah.
need some of these extra foods, but our body is not in a place where it can actually utilize it without support.
Exactly. Exactly. And that's where we get back to that root of digestion, the mechanical, the chemical, those
Yes.
enzymes, that hydrochloric acid, the structural. Do I have the gut integrity to keep out and keep in what I need? And the microbial, and they all work together. And from a functional nutrition perspective, we understand how sleep and exercise and sunlight impact your microbiome. It's not just one thing, it's again, broad perspective as opposed to
Yes.
just narrow.
Yes. Yes. And that scares people.
Yes, I know. It makes sense though. When people hear it, I think it does bring calm when they're looking for answers. Again, not when somebody's in a heightened alarm state where something needs immediate attention, but when they've
Right.
been looking and seeking answers and it's just like, wait, let's take a deep breath. I mean, oftentimes I
Yeah.
can ask somebody a simple question by looking at their serum labs. Are you hydrating enough? And
Right.
they might have been struggling with fatigue for a long time, and I can see their red blood cell function is off. And they'll be like, why do you ask me that? Like, wait,
Mhm.
yes, I struggle with that, but why are you asking? Our body
Right.
tells a story for
Yes.
us, and it
Yes.
shows up in those branches.
It shows up in the branches.
Yeah.
Exactly.
Yeah.
And it's the genetics that can help determine genetics and environment
Yes.
that can help determine which exact branch is going to start withering a little bit.
Yeah. Yeah.
Yeah.
Yeah.
Yeah. Yeah. I have a nice chart about that. And I think you do too, actually.
Yes.
Where's
Yeah.
my
We love
water?
our charts.
Talking about water.
Water. Let's take a sip of our water. Yes. Earlier before we got on the call, Christina, we were talking about sugar and sugar addiction. And,
Mhm.
one thing that's changed for my practice and my teaching over time is when I started in the field, 2 decades ago, I really looked at eliminating the top inflammatory foods, refined sugar, gluten, and dairy. And those were my non negotiables. And that started way back before I was even a practitioner when my late husband was diagnosed with a brain tumor. And I was able to see the research around the sugar consumption and cell growth, right? Like the sugar
Mhm.
is rapidly feeding the cells. And of course, tumor cells are the fastest growing in the body of an adult. And so we eliminated sugar. And I learned a lot when there wasn't a lot online. It wasn't a noisy space like it is now. Um,
Yeah.
about the elimination of sugar, and that became part of what I would teach. I've learned over time to kind of shift the perspective. So my non-negotiables aren't gluten, dairy, and sugar. They're sleep, poop, and blood sugar balance. And that again allows us to kind of shift our thinking around a food or a food topic being bad or good and being something we can have shame around, to
Right.
let's focus on these physiological functions and
Mhm.
optimize there so that we can track what shifts in your cravings, in your mood, in your symptoms, all of those things. But that's been
That's
an
right.
interesting transition for me because it used to be more dietary focused. And I really noticed that, like, a lot of my students were struggling because they'd show up in sessions and being like, we have to get rid of sugar, gluten, and dairy. And their clients or potential clients would ghost them too much too soon.
Way too much too soon.
Yes.
This reminds me of one of my favorite client stories, which is this 64-year-old woman, moderately overweight, not morbidly obese, but, you know, definitely needed to lose weight. Very high kidney, her kidney numbers were off, her liver numbers were off. She had, non-alcoholic fatty liver disease. She had uncontrolled type 2 diabetes. She was very depressed and anxious because she knew that if this continued, she was probably going to die sooner rather than later. She felt
Yes.
very out of control. And she comes in and sits down and she says, I'm going to need years of therapy for emotional eating. And in my head, I thought, we'll see about that. Of course, I didn't say that at that point in time. I just got some more information from her that where she said, yeah, I've been a compulsive overeater for 30 years.
Yeah.
And I've gone to doctors and I've gone to OA and I've done this and I've done that, and nothing has worked.
Yes.
I said, well, I'm really sorry to hear that. What do you compulsively overeat? Potato chips. Okay, this poor woman has been eating potato chips for 30 years and not much else.
Yeah. Wow.
And yeah, and so I got a 3-day food diary from her, and it was potato chips
Oh, wow.
and bowls of vanilla ice cream. And
Wow.
over 3 days, she had eaten exactly 2 deep fried chicken legs. This woman was so nutrient deprived
Totally.
that
Of
her
course.
body was desperately trying to make up in quantity of potato chips
Yes.
that it was missing in quality of nutrients.
Absolutely.
Right? And so I said to her, I said, you know what? Let's not worry about you stopping your vanilla ice cream or you stopping your potato chips. You just keep eating whatever it is you need to eat. But would you be willing to add a few things? And she was very willing to add a few things. So we added 9 servings of fruits and vegetables and brainstormed how to do that.
Yep.
We added 20 grams of protein every 4 hours.
Mm-hmm.
And I was very concrete and very specific, and we brainstormed how to make that happen.
Yep.
And that was the entire first session, was
Yeah,
just that.
and that's when I think about food through the lens of the experience I have at this point, the principles that I'm going to bring in around food are fat, fiber, protein at every meal or snack. So then we're saying, like, if you are eating ice cream, how are we putting some nuts and sprinkling some flax seeds? We're thinking into how do we crowd out instead of eliminate? So, fat, fiber, protein at every meal or snack. Eat the rainbow, which brings us to your servings of fruits and
Mhm.
vegetables, which gives us not just a lot of fiber, but a lot of phytonutrients that help with a
Yep.
lot of things in the body and brain. And then know your yes, no, maybe list. And that having that conversation with people is very illuminating. So I will say that sometimes we're encountering somebody who's like, I don't feel good. I have all these signs and symptoms and pains and lab markers that are worrisome, but nothing, I don't know what makes me feel better or worse. I just feel bad all the time.
Right.
That's not typically the person who comes into my world. My world is more the people who are trying to control their symptoms so desperately through food that they've narrowed their foods down to 3 to 5 foods. And now they have conditioned food hypersensitivity because they haven't done the internal healing so
That's
that
right.
they can receive the broad array of nutrients. So they are equally nutrient deprived to our potato chip ice cream
Yes.
eating person, but they're there from they're there through control and
For a
not
very different
getting the
reason.
right
Right. Right.
support.
And of course, the name that's been put to that is orthorexia.
Yeah.
But what was so interesting about this woman is that when she came back a week later, she was beaming.
Oh, I
She
love
said,
it.
I have not eaten one potato chip the entire week.
Yep.
I have not eaten any ice cream this entire week.
Yep.
I haven't wanted it.
Yes.
And that's when I explained to her, right, you don't need it now because your brain and body is getting the nutrients it requires. And so
Exactly.
it can let go of the potato chips and the ice cream.
Exactly. And
Right?
it's such a beautiful approach to crowd out instead of taking away. When we take away
Yeah.
too soon, people's reaction to don't tell me what to do or I can't do that comes up very quickly. But when we bring in, then they experience
We're
something
bringing
different
in
themselves.
balance and then the body balances itself.
Yes, beautifully
But
said.
so the third week, this woman comes in really despondent. And she said that everything had been great until last night. And last night at 10 o'clock, out of the blue, I got a craving for potato chips, and I went to the store and I ate 2 bags of potato chips. And she was so upset at herself, right?
Yeah.
And to her, the craving came out of the blue. Well, I knew very well that that craving had not come out of any blue,
Right.
right?
Yes.
So I said, okay, well, let's look at what happened earlier in the day. Did you eat breakfast? Great
Yep,
breakfast.
exactly.
Did you eat lunch? Great lunch. Did you eat your afternoon protein snack? Like your 20 grams of protein every 4 hours.
Yep.
Well, there was a reason why I had that little structure in place. And no, she got too busy at work. It turned out because of her codependency, because she was doing things for coworkers, right? So her self care went out the window,
Yep.
and she had missed her afternoon snack. Got home from work and was so exhausted because she'd missed her afternoon snack that she went to bed without dinner.
Yep.
Woke up 2.5 hours later, really anxious. Well, of course, her blood sugar had dropped, her adrenaline had kicked in, and now she was anxious.
Yeah, of
So she
course.
was so anxious about all the work she hadn't finished that she went straight to her computer and worked until 10 o'clock at night.
Yes.
Whereupon the brain said, I need potato chips.
Yep. Exactly. Exactly.
And as she's telling me this story, Andrea, her eyes were getting bigger and bigger. And
Yes.
she said, I was hungry, wasn't I?
Mm-hmm.
Yeah, you were
Yeah.
hungry.
Yes. And I love this story because it really does position the work we do as educators, not
Mhm.
just about the information. And this is something I think my students can get caught up in, that they have to be the experts in the information and the physiology, but we just have to listen. And what you were able to do there is understand the story and start making connections. And then she owns it. That's
Then
the
she owns it.
beauty of the work we do. We want to give people back their agency. And the only way we can do that is by helping them make the connections between what they're feeling and experiencing and what's happened in the day. It's kind of like micro timelining. Like, when did that start? Let's look at what happened. So I love that story because there's transformation occurring, not just in her signs and symptoms, but also in her ability to manage her life.
Well, exactly. And now we very, naturally got into what were the driving emotional dynamics,
Yeah.
which was needing to take care of everybody else and not
Right.
herself.
Right.
And so we spent a couple of months working on that. And at the end of a couple of months, she didn't need me anymore.
Which is the best.
All her numbers had come down.
Yeah.
She was losing weight. She was so grateful.
Hmm.
Right? She said, you
Yes.
saved my life. And she said, well, why didn't anybody else make it this simple before?
I know. I know.
I
Good.
said,
I love this story. Yes. I think one of the things that we have to recognize that this makes me think of, and I'm also thinking about a recent client that I've been working with who's a family member, because mostly I'm teaching other
"Hmm,
practitioners, is just the amount of shame that comes
yeah,
when not only around food, but around when we can't manage our life, our emotions, and our
mhm,
bodies. And
right,
holding
right.
space for that piece of it, as opposed to just railroading past it to the fix, I think is, just a testament to your story and your approach, that you were able to hear and pivot based on how she was showing up.
That's right. Yeah. And this is what makes it fun.
So fun.
Yeah. Because we get to personalize it.
Exactly. Exactly. That's so right.
But personalizing it according to principles.
Sure. Absolutely. Yes. I think that's what, helps us to personalized within a structured system, which gives us all relief, provider and client or patient.
Mhm, mhm. Absolutely. Anything else you can think of that we should talk about?
Yeah, I think that when talk about the three roots, many branches, again, like those branches are the signs, the symptoms, and the diagnoses. And we have to just know, like, am I addressing a branch because it's necessary right now, like what we talked about, or am I going to the roots, or how am I working with all of that? I also think of my third principle. So I had the matrix, the three roots, many branches, and then I have what I call the three tiers to nutrition or epigenetic mastery. And those three tiers start with the non negotiables. That's tier one, deficiency to sufficiency, which really speaks to your work, and dismantling the dysfunction. So, what I try to help people understand in the realm of nutrition is our job isn't necessarily to dismantle the dysfunction directly, it's to
Mhm.
dismantle the dysfunction indirectly by focusing on tier one, tier two. So, tier
Right.
one, non negotiables, sleep, poop, blood sugar balance. If that's where I'm focusing to begin with, those are my non negotiables in practice.
Right.
But I also want to understand the person's non negotiables for themselves. What
Mhm.
helps you to feel better or makes you feel worse? In functional medicine, we call these the mediators. So, the more I understand my client or patient's mediators, the more I'm making space to adapt what I'm recommending in relationship to them. And these aren't sequential or linear. I might have to work on a deficiency as part of a non negotiable, like you
Mhm.
were there in like this person's nutrient deficient. They need fiber, they need protein. Like those are deficiencies. A deficiency can be in those nutrients, a deficiency could be in the digestive enzymes or hydrochloric acid or vitamin D or a B vitamin. Deficiencies can also be in joy. They can be in like pleasure. They can be in laughter, right? They could be in relaxation.
Right.
So I like to just make sure that when we're thinking about these things, we're not always in you got to do this arena. It's like what makes you laugh? And how do we get more of that into your life? Is there a place where you can be there, feel that? And one of the things that my practice of narrative medicine and my study has really brought me to is understanding the small moments. You know, we think of them maybe as glimmers versus triggers. Like, how do we tune in when we're moved, when we're feeling something? There is a pharmacy within our
Mm.
bodies. Belonging turns off inflammatory genes as much as high doses of curcumin does. And so we have to
Amazing.
remember that there's science behind what is happening within us, and it doesn't always come from agents outside of us.
You know, Dr. Blum, Kenneth Blum, who was one of the first researchers to really look at some of the genes driving addictive and mood behaviors and how we can affect that using amino acids. He did a study of 12-step program engagement and how that actually supported neurotransmitter function in the brain. And that, yes, he's all for using amino acids and other nutrients. Yep, absolutely. And by going to a 12-step program and putting out chairs every Friday night and making the coffee every Monday morning, you are experiencing belonging
Yeah.
and being needed.
Yes.
And belonging and being needed raises serotonin levels.
Yeah, purpose is a huge part of longevity, and
Yes.
we really overlook that notion of where am I needed? What am I needed for? And in certain times of our life, that shifts pretty considerably. You know, I mentioned that
Mhm.
I'm the mother of an adult son, and as my role as mother shifted. And I felt like, wait a minute, I I've been a parent for 23 at that point years, and like this is my role, right? No,
Right.
mom, like I got to do this. And that becomes a reckoning that is
Yes.
real inside the body because our roles shift at different times of life, whether it's age or a work environment or a relationship. And all of that is part of the health equation. And so, like you're talking about with the belonging and being needed, there's a lot of studies about loneliness. Let's flip that. And the positive is the belonging. Where do I belong? And
That's
how
right.
do I nurture that?
And what just occurred to me is, I talk about my three-legged stool.
Yes,
Things are biochemical,
yes,
psychosocial, and spiritual.
yes,
And you can't, sit comfortably on a three-legged stool that only has two legs.
correct.
And so I like to separate this out. I like to teach about each leg, right? I need to make sure we're paying attention to each leg. And at the same time, if attending a 12-step meeting and helping out raises neurotransmitter function, now our three legs are getting a little blurry,
Mhm.
right? Now that
Exactly. Good
each
point.
leg is supporting the other leg.
Exactly. And that's where the matrix comes in.
Yeah.
My mantra, which is a good place when you say, is there anything else we need to know? My mantra is everything is connected. We are all unique and all things matter. Lunch
All
matters,
things matter.
sleep
Absolutely.
matters, belonging matters, all things matter. So whether you're doing them all or you're doing a few, know you're making a difference for yourself.
Yeah.
Yeah.
Yeah. This was a very fun conversation.
So much fun. I knew it would be.
So, any final words for our
Just want
listeners?
to thank you for your work and your expertise and what you're doing in the world and writing books and teaching practitioners and being a mentor and a friend. Thank you for including me in the conversation. Yeah, I just am
Oh, you're
happy to be
so
with you.
welcome. And thank you for being here because you also have so much wisdom and experience
Thank you.
and joy to
Thank you.
offer.
Thank you. We
Yeah.
appreciate that.
So, everyone, thank you so much for joining us in this lively conversation and episode. And if you enjoyed it, please push the like button. Please share it with friends and neighbors. Please subscribe, and we'll see you next time. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.